but 10 minutes gives me time for one or two messages. But I'm going to go back all the way back to the beginnings of our country, and why I think it's important to start there, because there's no doubt in our minds, I think, that the U.S. is unique in the world among nations in our response to the pandemic. We pay the most for healthcare by far. It's in total and per capita. And we have the CDC, which is the gold standard organization among public health agencies worldwide. It was an agency that was created to protect American citizens from health threats located in and outside the country. And so we're wondering, why on earth, with all of these resources, are we having this response? And we like to, as progressives, we like to blame our president and in our polarized politics for why we have such an extremely poor public health response. But it's much more than that. And I think historically, we have to go all the way back to the Revolutionary War and our country's foundation, because so much of our behavior can be explained by our Constitution, and our response to the pandemic is no different than that. So I'm putting up a Malcolm Gladwell quote, who recently said in an interview that public health was the greatest invention of the 20th century. But I'd like to contend that there's no question that public health, I think, is man's greatest invention. By man, I mean human, over the history of our species. And I think that both meanings of the term public health seen on the slide are important to what I'm going to talk about today, because public health is not specifically medical care. Although we like to emphasize one person, and it's not the health of an individual, but it recognizes that if one individual has an infectious disease, it's something that threatens everyone. Public health focuses on improving and protecting community health and well-being, with an emphasis on disease prevention across all of our populations. So this slide I created since the last time I did this, and this is American life expectancy at birth for white males, and that was a category that was easy to pick. Females live longer, but the slide shows the timeline of major medical and public health advancements since the birth of our country. And you can see around the time of the American Revolution that the life expectancy in the US was around 36. And unfortunately at the time, we hadn't had all the advancements that are made here along this timeline. Many doctors in this time suspected that infectious diseases were transmitted by air or by contact, but the germ theory, which was in this area here, hadn't even been proposed yet. So we didn't know about pathogens that led to disease. And that timeline that we have here is the main evidence for Malcolm Gladwell's theory. The concept of public health can be explained by the measure of life expectancy. In fact, life expectancy has been called the best outcome measure in the world for evaluating population health and the value of public health care systems. And so the corollary to that is that the longer a nation's people survive, the greater the value derived from the nation's overall investment in health. So if we look at life expectancy for a white male in the colonies back in 1787, around this area, it was around 38 years. And by 1900, it was 46 years. And by 2000, it was 76 years. So the fastest increase in life expectancy happened alongside what we call here, in this area here, the golden age of medicine, which is generally considered to be the 70 years between 1900 and 1970. But something very important happened between the Revolutionary War and the beginning of that golden age. And I'll get to that right after I set the stage by talking about George Washington at Valley Forge. Why we're so different in the United States when it comes to public health in 2020 requires a bit of understanding. I'll try to be brief, but I'm also going to give you a perspective on our history that I don't think you've ever heard before. The real reason that General Washington had trouble recruiting civilians was because those who joined the Continental Army were almost sure to become ill from one of many infectious diseases that included typhoid, dysentery, tuberculosis, pneumonia, smallpox, and these occurred as a result of living in close quarters. And it was the mothers who didn't want to lose their healthy sons, you know, off the farm and to the diseases of the Continental Army. And they're the ones that resisted the appeal to let their young men join up. And there are many examples of sickness and death due to the contagious diseases during the war. So here we show an example of John Adams' response to the smallpox that was sweeping through the army. And for example, the 10,000 men that they sent to capture Quebec, about half of them became sick with smallpox along the way. Hundreds died before they even reached their objective. And what was left of the sickly troops had to retreat back to Fort Ticonderoga in New York. And they were so weak that they just had to leave their cannons behind. And those who were fortunate enough to fall ill in Quebec were nursed by the people they were going to capture and sent home after that. So John Adams actually called smallpox the king of terrors. During the Revolution, during the Revolutionary War, in fact, only 6,800 men died in action, but another 17,000 died of disease. And that's something they don't teach in American history, I don't think. But think of the parents of those young lads. Washington wanted to recruit them to fight the British, and it wasn't that they weren't supportive of the cause, but the parents were right to worry about how the army was going to affect their kids and especially disfiguring them. John Adams admits as much in the letters that he wrote, and Washington as well. So we're going to enter Friedrich von Steuben at Valley Forge. Now, von Steuben was a military officer from Germany who arrived at Valley Forge from Europe in the record cold winter of 1778. And he knew from the European battlefields the latest military strategies and military discipline. But he had knowledge also of the latest practices of hygiene and medical care. When things looked really, really bleak as they possibly could for Washington, von Steuben turned everything around and changed not just the fate of the soldiers in Valley Forge, but likely the outcome of the Revolutionary War. So what did he do that was so different? He wasn't a doctor, but he knew that the general consensus among European doctors was that the contagions of the day were both airborne and transmitted by contact to other humans. So he used those techniques that were working in Europe to keep his American soldiers healthy. He took one look at the appalling conditions in the barracks, and he knew that changes had to be made. So here are a few statistics to keep in mind about Valley Forge. In all, there were about 2,500 men who died. That's 20% of the 12,000 men they had in Valley Forge in the encampment. And they died mostly due to typhoid and dysentery. And that spread quickly from person to person as they were living in close quarters. Now, deaths were a regular occurrence right up to the arrival of von Steuben, but very few died after he arrived. So the first thing he did was order new latrines to be built on the opposite side of the camp from the cookhouses. Makes sense. Up until then, the men had just been randomly defecating just about anywhere and everywhere. He rearranged the men so that the sick were quarantined together. He ordered them to use the latrines so they didn't just go anywhere. He ordered individuals who weren't sick into smaller barracks that they constructed. And here's a little picture, and you can see all of the little, instead of one common center, they're building smaller little barracks. And immediately the rate of the disease fell. So von Steuben knew that the routines that were working in Europe, and we're really working with the same tools during COVID. We've got those same tools to work with. Nothing really has changed until we all get the vaccine. But that is distancing, quarantine, isolation. For those, foolish people who say that there's no evidence that it works, here's the first example in American history that it does. In fact, there might not have been a United States of America if it weren't for these ancient protocols. So we go to the Thomas Shackman quote. Now, Washington spent a great deal of time worrying about smallpox. Boston and Philadelphia near Valley Forge were two sites of the great smallpox epidemic that was raging across the colonies at the time. And he knew about its deadly consequences since he himself had become, he almost died from it as a teenager, and he became facially scarred for life, something you don't see in all those glamorized photo or portraitures. But in fact, his first general orders that he ever wrote were about smallpox. And he wrote many letters. Washington was at first against inoculating the troops for smallpox. This is because to do it properly, the men had to actually isolate for a couple of weeks before and after, a week before and a week after the procedure. His wife Martha was also dead against it for her own two children. They were from her previous marriage, and they heavily influenced his decision making. We have lots of paintings of battles, but we've got no paintings of inoculations, unfortunately. So this is a recreation. But after the disastrous Quebec expedition, Washington finally relented and actually defied a congressional order not to inoculate the troops. He made sure that every soldier thereafter was inoculated. Even Martha got inoculated when she accidentally came into contact with infected soldiers. So the following year after Valley Forge, infection rates in the Continental Army fell from around 20% to less than 1%. And if that's not proof that science, as mysterious and as primitive as it was back then, I think it says that it definitely works to overcome a pandemic. And Minnesota historian Thomas Shackman certainly agreed that nothing that Washington did had a greater impact on the outcome of the war than his actions to protect his troops from death by smallpox. Although they really didn't even realize what they were doing, von Steuben and Washington had really just made the first public health orders in American history. And this begs a question, I think: how would our Constitution have been written if our knowledge of diseases and healthcare had just been a little more advanced? Had Washington understood more about health matters, he could have justifiably claimed that foreign infectious disease threatens national security just as much as any external military threat. Had medicine been a century more advanced, the government would have likely offered equitable and accessible public health care as part of a national defense system of the country and ensure the safety and well-beings of the citizens against diseases. I think it would have been seen as a responsibility so important that only the federal government would have been entrusted to oversee and maintain it. And enshrining it into the US Constitution would have been a common sense and really a practical thing to do. But because even the most advanced medical knowledge didn't make much of a difference in 1787, it never really occurred to Washington and the framers that this was anything that should be protected against. And constitutionally speaking, we got guns and bullets instead of medicine and hygiene, unfortunately.
So Henry, can you sum up in a minute or two?
I can.
Okay, thanks.
Okay. So there was an advancement between 1776, and it was all of these things. And it made a difference. It made a difference going to hospitals after that. People went to hospitals before that to die. They went to get their legs amputated. They went to get bloodlet. And this guy came along, Otto von Bismarck, with the sickness funds. And it's interesting that he provided a countervailing power against the modern forces of socialism. And he was gathering the Holy Roman Empire of the Germanic peoples together and created Germany at the time. And this was his way of doing it. And it's interesting that it's against socialism, but his great quote, that when vulnerable citizens have an inability to access needed care, society has a responsibility to step in and redistribute resources to fill the equity gap. These redistribution policies can only be filled by the government, and they need the old to pay for the young, and young pay for the old, and the healthy to pay for the sick. Now, that's a concept that we've heard many times. He's the one that started it, and really that was the beginning of modern healthcare. And I just go back to say that by this time, American exceptionalism had taken hold in the United States, and we were so in love with our Constitution, and still are, that we never ever thought to change it, and be pragmatic about what disease and meant to our population. And to this day, it's still being devastated. We remain the outlier in every way in the world. And everywhere you see these other countries, yes, we've all had a spike lately, every country in the world, but United States, seems to have an order of magnitude spike. Everything happens here that happens in healthcare is by every measure the worst. And it's going to continue that way until we rationalize our healthcare and rationalize our policies. And I'll end it there. Mike, I hope you got